More in Singapore are staying single compared to the last decade. The census shows the biggest increase among people between 25 and 35 years old. One expert says this trend may mean more challenges for healthcare and infrastructural needs over the next few decades. Alif Hamzah has more.
She's got a degree in architecture and now has many plans, such as getting a job. But there's one thing not on Eileen Feng's list so far, and that's starting a family.
I would say it's not a very high priority for me right now because I'm still focusing on my career and myself. But I have thought about it, and it's something that, if it happens, I would be happy. It'd be like a bonus in life.
But she's worried that staying single could mean her not getting certain housing grants.
My biggest worry is if I were to stay in Singapore, I know that a lot of policies are shaped around having a family and settling down. So if I were to stay single for the rest of my life, I think it would definitely be a financial worry at least.
There were more singles across all age groups over the last decade. The biggest rise is for those 25 to 29. The proportion of single women went up to 69% from 54%. Single men from roughly 75 to about 81%. Not far behind were those 30 to 34. Single women made up nearly 33% compared to the previous 25. The men increased by about 5%. It includes 32-year-old Matthew Quek, who says the main priority is his career, but that comes with its own worries.
It would be one of the consistent concerns among singles, which is dying alone. So, you've heard of reports in the papers where, the elderly have been found living alone, right? And then all of a sudden, they are discovered to have passed away alone in their own flat. But I kind of feel that that's something that can be worked around, to make friends with your neighbors, especially.
Meantime, one expert says the numbers are an early sign that fertility rates will go down further.
Fewer younger adults will support older or aging population. So the implication is on the labor market participation and the increasing cost of labor, and also the increasing expenditure on health care.
She suggests raising awareness among singles to plan their finances better for long-term healthcare needs. Policies should also start to cater to more of them.
The social needs of those single persons will be much more important, as it's likely that they don't have family members to live with or to receive sufficient support or social connections. So the communal space in HDB, which is important infrastructure, will help neighbors and residents to connect with each other.
Dr. Koh adds this could include grassroots organizations or community centers in long-term programs to make sure that singles are not isolated as they get older.